And I know that you keep really a foot in the laboratory still and are very interested in the translational science as well. Anything this year that's standing out to you as being particularly exciting?
Yeah, you've touched a subject that's key to my heart. And so, I think there are a lot of, as you kind of discuss, biomarkers that are starting to be evaluated. The combined positive scores, PD-L1 expression is the one that's really taken a hold in head and neck cancer. I think HPV is something that we also look very closely to, but one that's really gained a lot of attention across cancer and is of interest to me is circulating tumor DNA. And so how I like to explain it to my patients is that ctDNA is can be measured in many different forms. So in the blood, in the urine, it can be measured in saliva. And how to think about it is that all cells eventually die and will release their DNA into the blood. And so tumor cells are very much the same. So when they die either on their own or with treatment, we can not only detect tumor-specific DNA in the blood, for example, but we can also quantify it. And so, within head and neck cancers, there's really been great progress in HPV-associated head and neck cancers, and leading, even to a blood test that now is commercialized and we can order it for our patients. And so there's more emerging data with CT HPV DNA and what the best way to treat it or to use it. So there are many different applications. Can we use it to measure response to therapy? Can we use it to detect disease recurrence? Can we use it to either increase or decrease the type of therapy that we give? And so at ASCO this year, there was clinical trial data that looked at CT HPV DNA in a previously completed study in patients that had HPV associated head and neck cancers in the curative setting. And I think what was really interesting about this is one, that the study showed that we can measure CT HPV DNA, and two, when they looked at the difference between patients who received chemoradiation therapy versus radiation therapy alone, they found that the ctDNA clearance, so at the start of treatment, at the end of treatment, was better in patients that had received chemoradiation therapy. So again, that just shows that maybe the continued use of chemoradiation therapy is going to be helpful in this population. I think the other exciting data is just showing and tying in with clinical outcomes. So patients that clear their CT HPV DNA have better outcomes in terms of recurrence rates. And so, I think this is just continues to be a really exciting yet new field. And hopefully we're going to see maybe full incorporation of this technology into HPV associated patients, but also into our HPV negative patients, that it's much harder and more complicated to measure ctDNA, but I think again, an active area of investigation. How about you? Anything else that makes you excited?
Yeah, I thought the ctDNA data was really interesting, and I think it offers us possibilities in future clinical trials to study, could we de-escalate treatment for people who clear quickly? Should we give more treatment to people who don't? So I really loved that data. That was the main, I think, preclinical study that stuck out to me at ASCO this year. Were there any others for you that made an impression?
Yeah, I agree. That was kind of the big data that's been presented at ASCO and some other of our head and neck conferences. So we'll just have to see how it evolves over time. Perfect.